the new National Health Service starts, providing hospital and specialist services, medicines, drugs and appliances, care of the teeth and eyes, maternity services.
After the Second World War, Britain changed dramatically, and so did the lives of its people. One of the most significant developments was a new National Health Service, which began in 1948. It meant that for the first time, anyone who was ill could be treated for free, and the health of the nation improved dramatically. 15-year-old Kirsty from High Wycombe has good reason to be grateful to the NHS. It saved her life when she was rushed to hospital with suspected meningitis.
That made me realise quite how amazing the doctors were. So that's when I decided I wanted to be a doctor.
Kirsty wants to investigate what impact the NHS had on people's lives. 60 years ago, Eileen, Kirsty's grandmother, owed her life to the new service.
Well, this one is taken over at Peppered with my mother.
To me, you look quite healthy.
Yeah, well, I mean, I don't think I've ever looked ill when I am ill.
Back in 1952, although Eileen felt healthy, she took up the offer of a free test by one of the new NHS mobile X-ray units set up across Britain to identify individuals who were sick.
They just took a small X-ray. About a couple of weeks later, I had a letter saying, would I attend the chest clinic at Wycombe Hospital, that there was a shadow on my right lung.
The X-ray revealed that Eileen had TB, or tuberculosis, a highly contagious disease that was responsible for 10,000 deaths a year. She was forced to spend the next 6 months in isolation in a sanatorium. Many of the patients in these long-term hospitals were children who ended up missing months or even years of school.
Of course, once the NHS came in, well, you didn't have to worry about paying.
So you're thankful, obviously?
Yes, I mean, I didn't have any idea when I went that there was anything wrong with me.
Kirsty's come to meet 3 former nurses who worked for the new health service to find out how the NHS changed Britain.
Families were very poorly off because they used to save up for the doctor to come. There is no doubt about that. Money was put on the shelf in the kitchen just in case the doctor had to be called.
Prior to the health service, you know, some people sort of paid in kind rather than if they didn't have the money, that sort of thing.
A dozen eggs or whatever they could afford, vegetables for the garden, all came our way. I think vast amounts of the population probably fell through the net and were not treated. And therefore, this was why Mr. Attlee decided that really a National Health Service for all was the one thing that he strove to produce.
The new Labour Prime Minister, Clement Attlee, and his government had established the NHS in the face of considerable opposition. And it wasn't long before he too required treatment from the new service.
I nursed Clement Attlee in Amersham. He wouldn't go into a side ward. He said, oh no, I'm very pro the health service. So this long 25-bedded Nightingale ward, and he was about 4 beds down on the right in this ward, and chatting to all the other people and so on. He felt very strongly that he had pioneered for the NHS and he wanted to be like every other patient and be treated like everybody else.
Kirsty wants to find out more about life before the NHS and has come to see medical historian Dr. Carol Reeves.
So what were people's health expectations?
Obviously, people who had money, and they tended to be the upper class and the middle class people, they didn't have to worry too much about being ill because they knew that they could always afford to pay for doctors or hospitals. But if you were a working class person, it was very different, and your expectations generally were quite low. You didn't expect to feel well all of the time. As soon as 1948 happened and the NHS happened, all the patients who previously couldn't afford to come to the doctors came and saw doctors or hospitals.
So were people generally grateful?
Yes, hugely grateful. Wealthy.
But although patients welcomed the new health service, many of the doctors who were treating them were less enthusiastic.
They thought that they wouldn't get paid as much money because all of their patients were private and they could pretty much charge what they liked. So that was something that they didn't want to lose.
Yeah.
And what the NHS said to them, we'll let you keep your private patients and you can treat them in NHS hospitals.
Right.
And we'll just give you some salary, but we won't stop you treating private patients. So they actually did very well out of it. And what Aneurin Bevan said, the Minister of Health at the time, he said he was going to choke their mouths with gold in order for them to agree to the National Health Service.
A bit of a bribe.
A lot of a bribe.
The public now had access to all kinds of health professionals, including doctors, opticians and dentists. Kirsty's meeting Rachel Bairstow from the British Dental Association to find out about the state of the nation's teeth in 1948.
This might be an extreme example, but we can certainly say that people's teeth were not in a good state of
Not
repair.
at all.
Not at all. The average person could not access dental care prior to the NHS. I think we can say people weren't smiling.
Ordinary people flocked to receive free dental treatment, and the system fought to catch up on the years of neglect, starting with false teeth.
Basically, in the first 9 months of the NHS, they're making 33 million sets. It's a lot.
Yeah.
I mean, I think from a service that's set out to help mothers and children and to carry out conservation of teeth, that's what they wanted to do, that was their ideal. Actually, they ended up treating a backlog, if you like, of a nation's awful teeth. And so this is really what made the NHS have to stop and say, we need to introduce charges. There was always controversy, if you like, over how that was going to work, how dentists were paid. So these were the initial problems that the NHS had to face.
It will be a long time before she'll need false teeth. Yet many children are among the people in Britain, nearly half the population, who do wear false teeth.
Over the years, governments have introduced charges in the NHS, including paying to see the dentist. But the basic principle of the National Health Service, that you can go and see a doctor without paying whenever you are ill, remains.
It was a complete change of the way people thought about themselves, and they began to have much higher expectations of their health. They began to demand good health as their right, which of course we all expect now.
I thought it was very shocking that before the establishment of the NHS, most people expected to be ill. I think the government realised that there was a big issue that needed to be sorted. I think the Prime Minister at the time was very enthusiastic, pushed it through, and so did Bevan. People today do criticise the NHS, but I think that they need to look at what happened before. Yes, they do have to pay for it in taxes, and it's not the quickest thing, but overall, you're getting treated when you need to get treated. I really realise now quite how lucky Grandma was that she had TB after the NHS was established. She might not have been able to afford the treatment before the NHS. It's really made me want to fight for being a doctor.